I'm going to be doing a brief live answering one of the questions I got this week related to Alvesco. Alvesco is a maintenance inhaler, and thank you so much for that question. But what I need to focus with you is that this particular inhaler, when you get it out of the box, just so that I know, and you know, it has a counter that you have to look at. And this counter right now is 0 because mine, I've used it all up. But you want to look at your counter over here. And that's what I demonstrated on the video that you asked a question on. And I do not know how shy you may be, so I didn't want to expose you as a person. I just want to go over this, and I probably will make a short clip. I did promise you a short clip, but I haven't been able to gather myself to do that. And I just wanted to make sure the people who will be following me, that when they ask a question, I will try my best to go over it if it's appropriate to my topic of interest. My niche is really teaching people about asthma. And sticking to the basics, because if we don't go over the basic, many of you make a big mistake without realizing it. It looks like a minor step, like inhaler technique is important. Otherwise, your inhalers may be exaggerated in dose, or you may be upgraded to treatments that you probably don't need because we don't feel you're getting control, or we don't show that you're in control. So that causes you to get pretty much over-treated because you didn't get the basics right. So as we treat someone, we start with the basics and we go on and on and on, and we hide. We try to use something that is milder, and the mildest form of treatment for asthma or COPD is inhalers. So for the gentleman who asked me, or maybe the lady, I can't remember, who asked me about this and said, hey, I like your video, but I think you need to slow down a little bit and talk more about the beginning of the teaching. And I want to say, you get it out of the box and you look at the counter, and just remember, there's lots of inhalers. These look alike. I'm going to show you. These all look alike, and their technique is going to be the same, but they're very different, right? So this one is a rescue, this albuterol sulfate. This one is Air Supra. It's also a rescue, meaning you go for these when you have symptoms above your maintenance. So I just want you guys to know, first of all, I'm very happy that you're here. I want to tell you that I am going to try my best within TikTok and YouTube to go in and answer people questions. I want to stop you guys because you sometimes don't realize that when you're switching things that are as needed, like these three, and you're forgetting to use your maintenance, and you got to go and identify your maintenance inhaler, because that's what's key. You need to go and identify that. If you don't, and you start going on your rescues, it's either you're not using this maintenance inhaler the way it's scheduled, or you need one. It's one or the other, because you shouldn't really be on your rescues constantly. Once a month, okay, or right before you exercise, fine. You need these maybe 20 minutes before, maybe 30 minutes before exercise or anticipated exertional activity, whatever that may be for you, that's fine. But when you start using this and you're already on a maintenance, it's either this is screwed up or this is not dosed right. And if it's not dosed right, this here has one inhaler inside. They can come up to 3 inhalers inside one. Therefore, you don't want to compare notes with anybody else unless you have the exact same medication, exact same dose. And be careful with the last thing that I'm going to say. It is the actual frequency. So this one is on the clock twice a day. You make a mistake and you do this once a day, you're making a huge mistake on your control. And that could cost you admission, hospitalizations, steroids in excess that you don't need. There's a lot that can go on with that. So I just want you guys to know that these maintenance are key. They look like your rescues, but the maintenance are key. Yours could look like this, and this is supposed to be a short video, just letting you guys know that your questions, I pay attention to them. And they actually inspire me to, even when I'm not ready, I'm not all made up, to answer you guys. And I'm answering this particular person. So I'm gonna go back. Sorry that I'm going back and forth, but those inhalers that look like this, their directions of inhaler technique is the same, but the schedule is different. The maintenance that look like this are twice a day. So it's twice a day, morning, evening, morning, evening, morning, evening. It actually gradually builds. So if you go on and start using these sporadically, and they're supposed to be maintenance, and you're confusing them for your rescue, which is over here, right? Then you've screwed up your schedule. And when your doctor asks how you're doing, you cannot say that this is not working because you're not even on it, to be honest. Because if you're using this not as prescribed, you're using it as rescue, this is not a rescue. This is your maintenance device. So for those people who are visiting, if you can say hi, it's nice. Then I feel like I'm actually being watched rather than just talking to myself, which I do very often. So I'm gonna go over this because someone asked me a question on the video for Alvesco about this. And they said, thank you for the nice video, but can you slow down in the beginning because, you know, I didn't get the beginning. Well, the beginning is counter, check, make sure you have enough. It counts down, mine is out, it says red. You wanna make sure that you open it, right? The first time out of the box, thank you so much for the heart. It's going to need to be jump started, which I call prime jump start, the same, just to kind of make you understand that these little cans may not be flowing. You wanna check that by priming it the first time. The rescues you leave dormant. They're sitting down for, hopefully, if you're in good control, you forget you even have these rescues, right? Because you rarely use them. If you're using them constantly, you're hugging them, that means your control, this one, is not working or is not dosed right or something else is going on with you. And you got to check with your provider, okay? Because I'm not your provider, I'm just here educating. So once you check, you want to shake these, prime them, shake it up. Shake, 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 and then you want to prime. That is a nice prime. So that's all you need to do. Now you can get started on treatment. However, if you're using this as your rescue, you would do this every so often. You'll have to shake it again and prime it because it's been sitting there for a long time. If this is being used right, meaning it is your maintenance, you've identified it as your maintenance, it is the one that is supposed to be on the schedule. You've gotten smart, you've put it next to your toothbrush because you're going for your toothbrush twice a day, hopefully. And every time you're there, these are usually twice a day. That's how I order them for my patients, and that's how they should be ordered for you. So in case you swap things and swap the directions, go back to your doctor and say, how was it supposed to be prescribed? Twice a day, then you need to go there twice a day. And then, is it 1 puff twice a day or 2 puff twice a day? That's something that you need to know, because if it's 1 puff twice a day, you should be doing 1 puff twice a day. And what happens with that is it builds on itself. 1, 2, 3, 4, it goes up and up and up and all the way to 100% effect. But if you use it sporadically and it's your maintenance, you're going to lose your full effect. So it's going to be 1 and the next day 1. It's not going to escalate to maximal therapy. I just want you guys to know. Yes. Can Symbicort also be a rescue? No. No, unless there's a group of patients that we do prescribe these maintenance to be used as needed. I need you to clarify that. But I'm going to let you know that's a twice-a-day medication, the turbuhaler. It's similar to this. It's just shaped a little bit different. I may go and try to get one for you just to make sure you know how to use that, since you asked me a question. But I'm letting you know that that's a maintenance inhaler. It is twice a day. When I prescribe it, we have Symbicort here. Symbicort is an MDI for us, or it could be, in your case, a turbuhaler, right? It's a twist, because you probably live maybe in Europe somewhere, okay? I don't know if I'm right, okay? So I'm going to continue with this one. Shake it up, prime it the first time, and then you're going to shake it up and time it properly. So that's what you're gonna do. If you do not do that, you may just go, and it comes out. This is an exaggerated way of showing you, but you really want to make sure that that mist goes to your lung. And if you don't, the mist is going to go in your throat, and it's going to cause a lot of problems like sore throat, thrush, whiteness on your tongue, and all those good things, hoarseness sometimes, and you end up seeing doctors over the hoarseness because you never rinse your mouth. So I just want you to know that this is very important for you to know early how you use these, that you're propelling this inhaler down. It's an inhaler if it touches your lung. It's something else if it's just going to your throat, and we don't want it there. We want to use that force to go down into your lungs. So it's so important that you are paying attention to that, because if you're just going, it's going in your mouth, it's not gonna get down. If you actually grab that inhaler and you suck it in at the same time you're pressing, look at me. You see, nothing came out. But if you don't hold it long enough, and you don't pull it, it's gonna come out. So it's very important. And then you're gonna say, well, you know what, maybe I need a higher dose. You don't really necessarily need a higher dose, but you need to have an attentive doctor who checks that that's what you're doing before they go to higher dose. But what's quicker? Quicker would be just go ahead and give her the higher dose, because you're not gonna have the time with your doctor to start checking and being inquisitive about how well you're using that inhaler. So I want that person to know this is very easy to use if you know how to, and if you don't, we need to attach a spacer if that's what your doctor prescribed, or we need to use the twist kind of inhalers. So I really, 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 really appreciate you guys asking me questions. That's the whole point of me doing this live, and it's random, but I'm pretty sure you guys can look at some of these lives. I'll try to make sure that they are available for you to view. Please seek out your doctors and your providers and follow with them. Make sure that you're doing the right thing. The key lesson today is realizing that these inhalers are shaped the same. They may even have similar colors, but they have different things inside. These are rescues. They are rescues, meaning they are used for emergency or quick relief, etc., including this one. Unless your doctor says something else, this is a rescue. It's add-on. You use this and it doesn't work all the way. We add this for those moments, especially maybe if you're getting a cold, you're running into a flare-up, maybe you met that cat that you're not supposed to, and then you're starting to wheeze, you're going to use these if you're safe. If it's an asthma attack, obviously these are not going to work for you because you can't hold your breath. So again, my name is Dr. Mkono, and I think somebody asked me about the turbuhaler, so I'm just going to try to see if I can go grab it and show you guys, and then let you know that I am going to be here on doing lives. Hi, thank you from Poland. I'm going to be trying to do a little bit more of the lives, and if you live in a different part of the world, you still can use similar technique is the same, right? These inhalers the technique is the same, but your schedule is different. And you see what I do with my patients is I write a little tag there and I tell them, because they're of different age groups, some people are attentive, some people are not, but it's different age groups. So this, it's saying here, it says 2 puffs twice a day, because this is a maintenance inhaler. It didn't say as needed. Somebody should not make it as needed. When it's not as needed, do not make something that is scheduled to as needed, and vice versa. Do not make a rescue inhaler like these albuterol. For the most part, most of you have a rescue called albuterol. It's albuterol. You don't want to make that be you're constantly on it. That's a clue. If you are a good patient and you're constantly on albuterol, it means either this is not right, this maintenance one, or your maintenance is not dosed at the right dose for you, because they go from low to high, or the combination is not good for you, meaning it's not optimized for you, because they should in consecutive use, they should build and make you feel more calm in your lungs if you're delivering that breath to your lungs and it's working for you. So I'm going to go over the turbuhaler just because somebody asked me a question, and if they're still there, if they could let me know that they're still there, I'll still do it anyways, but just give me a moment to get the inhaler. So, and if there's anybody else who is out there with a question about inhaler, because I got my bag, if they're still there, I will do one. I really meant to actually go over one inhaler for today, but I'm happy to do it if you're here and you want me to go over another inhaler. This is how Symbicort looks where I prescribe, but yours could look different from wherever you are. The turbuhaler looks different. Excuse me for a moment. Oh yeah, there it is. Turbuhaler devices look like this. And again, you see, I'm labeling mine for my patients. I put the instructions on there because I have very old patients and sometimes very young who behave very old. So it doesn't matter. People forget, they get confused. This is a turbuhaler device. I know this is how it looks like for you guys, but this is a twisting motion. You see, our Symbicort looks like this. Your Symbicort may look like this. This is the device, the turbuhaler, and it has three, and I have a video about this. It has three creases, two creases and three parts. One part over here, see that? And then another part over here, and then another part right here. You want to grab this midsection with the bottom section, and you want to twist this way, and then twist back. And you heard that click? You exhale. Again, it's always that motion. It's only nebulizer that you're going to see mist, and in that you're doing slow and shallow in and out, or with a spacer. But in inhalers, you want to just make sure that once you've got your inhaler ready, for those that prime, you prime, and then you shake it again for those shake ones. These do not need to be shaked. They don't need to be primed. They're powder. When you actually tip them over, the powder comes out. But once you've done that twisting, you exhale, and then I counted to 10, maybe quite, I would say that if you could slow that down and count slower, it's better. And then you want to then, if you prescribe one puff, that's it, that's your one puff. Twice a day, then you go in the evening and you do it again. If it's two puffs, you will then go and do your second puff, which is again, twisting. You twist one way, and then you twist. You heard that click? Exhale. And the reason you exhale, let me tell you, asthmatics tend to trap air. Sometimes they go like, they're trying to get that air out. COPD people also do that, but you want to make sure that your lung is ready to receive a full breath of the lotion to the lung. I consider inhalers in a lotion. It's so mild. You just put it on your lung inner lining, and therefore you really need to take that breath that's very nice and full and healthy breath. So if it's going to be in with already a lung that's full, like for instance, you already take, and then you're just going to take very shallow breath, and it's only going to stack over here. It may not go deep down. You want to make sure you empty, and then so that's basically it. And this is the turbuhaler. And this is also scheduled twice a day when I prescribe it. I don't want to be getting in people's prescriptions, but this is a twice a day medication. And if we're lowering it, we're going to lower the dose. Not really necessarily say to you, use one puff a day unless, you know, there's extraordinary circumstances for you and your doctor. And as you lower or higher it, you're just going to check with your breathing test for those who are blessed to have doctors who can just check breathing tests and you can afford it. Otherwise, you find the lowest level that works, and that's the lowest level that you would use and work with. How do you know it works? You don't need your rescues, these ones, often. You don't keep getting bronchitis after bronchitis and bronchitis. These are your rescue inhalers. Well, not this one. This one, and this one, and this one. They're rescues. If you're constantly on this, it's a clue that this or your maintenance of choice, whichever one your doctor's decided, is not working for you. So these are just me going over this with you guys, and hopefully I wasn't too fast. And for those who benefited, I'm really, really happy. If you didn't ask me a question, I'm more than happy to join in next time and go over your question. I'm just going to review. Oh, GERD. GERD is going to affect you in the sense of acidity pouring into your lungs, and the acidity, okay, so the GERD is actually in the stomach component, But because your esophagus and you've got two pipes over here and they sit right next to each other, very slim, and they go right in down into your chest area. The stomach is passing through and goes down to the stomach. The esophagus goes down. Excuse me. The esophagus is coming from back here. It goes down and into your stomach. Your lungs, they go down right in the same middle chest area, right next to each other, and they go into the two lungs. However, if you have reflux, some of the content from the stomach is pouring over. Like two holes are over here, one pours the acidity in the back of the throat, and that irritates your lungs. Now, you could have asthma and then the reflux makes it worse, okay? Or you have, a very loose, it's supposed to protect you. When your stomach is feeding, it's protecting you from the lungs, and you're supposed to have them separated. However, if acidity is climbing up the tube, it may pour over and affect you. So you start having wheezing and, all the good stuff related to the asthma, but related to the reflux, flaring it up. So they're very related, and it's a very good topic to go over. I may actually post something from my TikTok that I discuss reflux, because that's another one. Reflux, I may even already have it. Reflux can post-nasal drip, can also make you feel like you're having a lot more coughing. And sometimes we call those people cough variant asthma. They have post-nasal drip and their asthma, and they're interacting because now the nose is dripping into the airway and causing you to cough as well. So sometimes asthmatics have the nose thing going on, the lung thing going on, the eczema thing going on. All those are allergic responses to your body. They don't like those allergens, and they're causing you to feel like you need to cough. The lung feels like there's something on them that it needs to get rid of. So again, my name is Dr. Mkono. I hope this was helpful for the patients that follow me. I'm so glad you're here. Hopefully we spend enough time in the office that you don't need review, but if you did, you're here. Go over the material that is here. Make sure that you're including your providers. I'm only supposed to be teaching you. I do not prescribe. So if you are listening to anything, go back and look at your prescription. That's the first thing you do. And see, did it say once a day? Did it say twice a day? Did it say as needed? Please don't give yourself a prescription of an as needed on an inhaler that is scheduled. Please don't do that, because that would really affect you and you will not get a benefit from the inhalers. Remember to give inhalers time, because they need to work, and they work over a period of 1 to 2 weeks. So you want to be consistent for 1 to 2 weeks and then judge whether that works. Now, of course, if you're having a flare, involve your doctors early, because we then need to give you a big dose of most likely the good old steroid pill or IV, because we just want to shut everything down and then allow you to come back down to earth, and then we use the inhalers as maintenance. So I really, really appreciate your questions, joining me and everything. Follow me here, follow me on TikTok on both, and I'm just dedicated to inhaler teaching, because I find that you guys make the silliest mistakes sometimes without knowing. One is just humble yourself and go over the inhaler technique. Don't forget to rinse your mouth. This particular inhaler that made me come on the live needs to be rinsed off. If you don't remember which inhaler to rinse off, Albuterol, usually you don't need to unless you're really allergic to it, and you will look on your little label, it will say Albuterol sulfate. This one you would need to rinse off because it's got some steroid inside, even though it's a rescue. As far as I'm concerned, for simplicity's sake, this is a rescue. Don't make it your maintenance. It's dosed so low. It's only supposed to be an add-on to your maintenance. Symbicort is right over here. I don't think I need to show you guys because I just went over that. And then this one and this one. You got to rinse your mouth, gargle, water, spit out. All the best to you guys. I really appreciate you joining, and take care. See you next time.